Hi guys, welcome to the Metabolic Health Docs YouTube channel. Today, I wanted to tackle the topic of health equity, and joining me is Erikcajoy Daniels, who's the Senior Vice President and Chief Diversity, Equity, and Inclusion Officer at Advocate Health Midwest. She's also the author of a great book entitled Taking Care of Business While My Husband is at the Gate, a book I highly recommend. And I think it's important that we talk about health equity. It's a very important topic because we want healthcare to be accessible to all of us. So, Erikcajoy, do me a favor for my audience. Share with my audience what health equity means to you and why you think it's important.
Absolutely. Dr. Hampton, so thank you again for having me this morning, and what I hope will be a conversation that goes morning, evenings, and afternoons. But for me, when I think about the word health equity, I think about opportunity, just the opportunity for people to have their best, richest, wholest, healthiest lives. And unfortunately, there are individuals and communities who don't have that. And so that's been a personal pursuit of mine in my work, and also not just professionally, but personally. The extensions I have, the relationships I have of what are the gaps. Equity is all about closing gaps, and what there are gaps that we have to take one at a time. And if I can either ideate or support or invest into someone closing a gap, I can help them get closer to that equitable health.
Yeah, I'll ask you one more quick question. Some people think health equity and equal equal care is the same, like equitable care versus equal care. I mean, do you have any thoughts on that?
Absolutely. That's just thinking that if we just right size everyone with the same product, service, or delivering, that all outcomes will increase. And that's a farce. That's not really going to happen.
Yeah, I
And
agree.
that robs the opportunity just being curious about that person, those needs, and that situation and circumstance. Because if you overlay things, then you're going to miss the opportunities.
Yeah, I'm glad you said that because you triggered me, and it made me think about how I learned about health equity. And it actually was during my training at West Suburban Hospital in Oak Park, which is a great hospital, small community hospital just west of Chicago. And I did a family practice residency followed by a maternal child health fellowship. And I couldn't believe that people like my mom and even more so like you and my wife who are educated, all of this education, but yet your infant mortality rate and your miscarriage rate was
Yeah.
2 to 3 times higher. So
Yep.
how could it be that a person who's done all the right things, checked all the right boxes, and they still have a rate of pregnancy complications that's higher? And then I learned a little bit about it, and I learned that the cumulative stress that African American women have, which is slightly different, can be disruptive to their cortisol levels, and that cortisol disruption can then lead to increased risk for miscarriages and pregnancy complications. But I do have some good news. When I looked into this further, I found that one of the ways to mitigate that is by providing support, right? Who knew, right? So if you provide support to people who are in this higher risk category, you'll then have something actionable that you can do to kind of reduce that risk. So I really am excited about that. And I just think this is important because, we're all trying to, take care of the people we care about and love. And as clinicians and as leaders in healthcare, we're trying to do the same. So I just appreciate you coming to this video short just to kind of tease people with this topic, because we're going to spend more time on the Protecting Your Nest podcast talking about this topic. So for those who are checking out this video short, we'll make sure to have a link to that episode where Erikcajoy will, dive a little deeper. You'll get to know her more, and you'll get a chance to learn more about health equity so that you can do your part to improve that in our country and locally where you live. So I appreciate everybody who came to this video. And until the next video, continue to be safe, be well, and continue to protect your nest.